For now, we'll continue with our program, and I'd like to invite the director of the Campus Centre, Professor Barry Milne. Thank you.
Thank you. Kia ora koutou, welcome everyone. Ko Barry Milne ho, he manutaki aho ki Campus Research Centre. He ahorangi aho ki waka Manukau. So I'm Barry Milne, I'm the director of the Campus Research Centre. And I'm also a professor at the University of Auckland. I've been working with Campus for 15 years now. And this is, as often pointed out, this is the second community session that we've put on. And the last one was fantastic. I'm sure this one's going to be fantastic as well. Thank you very much to Natalia, who's been the prime person putting this all together with help from Martin and Lisa and others at Campus. What I thought I'd do just for 15 minutes or so is just talk to you a little bit about the Campus Research Centre and what we are, and also introduce the day. So first introducing today, so I'm going to talk just for 15 minutes about a bit about what Campus is and what we do. Then I'll pass back to Offa, who's going to give a presentation about brain health. So that I did a little bit of help with Zanetta Tamata. Pass over then to Natalia, who's going to be talking about treatment inequities and multiple sclerosis. And then pass over to Lisa, who's going to be talking about how us on the research side and you guys on the community side can work together. And then I'll finish up talking about a project that I worked on with then, they're not there now, but people who were working at Ministry for Pacific Peoples, as well as Jesse Kakaua at University of Otago and Troy Ruby at University of Otago on mental health for Pacific Peoples. And there's still a couple of reports over there that we've produced. Or we've produced a report, a couple of copies of which are still over there. Then we'll break for lunch, and after lunch, we're going to have a Talanoa session right here. So it will shift the table forward and put 4 chairs up the front. Lisa's going to moderate it, and we've got Ananya Lebias here from the Course Collective, Rich Easton from Neurological Alliance, Greer Pugh, who's a physiology PhD student at the University of Auckland, and Natalie Goulden, you just come in? Yes, from Motor Neuron Disease New Zealand, and also at the University of Auckland. And then I'll try and take some notes during the day and make a few closing remarks, and finish with a lot from Reverend Salah. Okay, so that's the plan for the day. What about us? So Campus preceded me. It was set up by Professor Peter Davis, who you may know, heard of. He set up Campus 2008. And it was a social science research centre before that. I joined in 2010. I took over as director in 2017. So there's me, Deputy Director Steph D'Souza, who's right there. Senior Research Fellows Lisa, who I've introduced already, and Offa, who you know. Offa does a little bit of work for us, but mostly work for the Langimalie Research Centre. Natalia, who I've already introduced as postdoctoral fellow. Sophie Mulan as well. I'll mention some of the work that Sophie does shortly. Martin's our data analyst. He's over there. We've got various students working with. We're not a teaching centre. We're a research centre. So we have to partner with people when we supervise students. Just the way the university works. So we've got various students from the sort of medical and health sciences, from public policy, from science. That's Alexia, Dita, and Fran. From those 3 faculties. Marianne is actually at the Victoria University Wellington. She's doing a project on AI. Paula is in psychology. Sylvia Zhang. Who's Sylvia Zhang? Psychology as well. And Tori Diamond's in statistics. And I think Amelia, who's our research manager, she'll be turning up later today. She's attending her child's assembly, I think, this morning. It's going to be a bit later. So we're a quantitative social science research centre. We analyse data to understand people's lives really across the life course. It's the type of stuff that we do. We get very, very basic funding, I think it's fair to say, from the University of Auckland. So all the stuff that we do, we have to bid for funding to do. And so we get funding from various sources. It's clamped up a little bit in the last couple of years, but primary New Zealand ones are the Health Research Council, the Ministry of Business, Innovation and Employment, Marsden Fund, and then the government agencies. And the government agency funding is really clamped up as well over the last couple of years. anyway, I'll just run through a few of the research projects that we've got on the go at the moment. At any one time, we're probably working on up to around 10 projects, and they may be big ones and they may be small ones. Kumanu Tangata, that's been led by Steph, the health impacts of playing rugby. So that project there, we use the New Zealand Administrative Data System, really, called the Integrated Data Infrastructure, which is a lot of contacts with government administrative sectors such as health, social development, justice, those sorts of things, and LinkedIn data provided from the New Zealand Rugby Union about people who played high-level rugby in New Zealand since 1950 to look at the health impacts of playing rugby. And it's got a 2024 end date there, but we're certainly carrying on and getting a few publications out there. The one below that, Perspectives of 100 Māori Creatives. That was an interesting one because we started working with Māori communities or Māori community group called Te Pairoa, and we were put on to them through kind of a friend, really. It was Marama Muru Lanning who put us on to people who worked at Ngāti Hawā to do a Papakainga housing survey for them. And then they put us on to Te Pairoa. I think their business name is Ngāpai Kitea Takui Limited, to run a survey, find out Māori who work in the creative industries, their experiences of essentially breaches of AI and their opinions on it. So yeah, so taking a step back, the three main things we kind of do at Compass are surveys, as the second one is there, analysing whole population data to understand health and wellbeing, as the first one is. And then we also do some simulation work where we use data often, sometimes that we collect ourselves and draw some associations from that analysis and build it into a simulation model. Those kind of three things we do. And so the research I'll cover off here, we cover probably, I think, two of those three. The third one there, and that's two projects. The first being funded by the HRC and the second one being funded by Multiple Sclerosis Research Trust. That's been led by Natalia to understand, firstly, Natalia, to just whether multiple sclerosis can be identified in administrative data and looking at treatments people are getting and other epidemiological aspects of multiple sclerosis. And we've got a multiple sclerosis and sort of rare disorders theme running at Compass with Lisa as well. Got funding from the Ember Wellbeing Trust to look at rare disorders in New Zealand. Sophie Mulan, who isn't here, but I mentioned her before, she's got a couple of tranches of funding. One through the Better Start Natural Science Challenge, which is funding we had for around 8 years. And in the wash-up of funding, they had a little bit of money left over and they funded this work. And more recently, directly from MSD, where she wants to understand the impact of the Families Package, which was a 2018 basically boost in funding to families, and want to evaluate essentially if it's had any impact on families and their children. So we worked on one paper that shows that it seems like it has a small effect at reducing child neglect outcomes, which is a good thing. And Sophie's going to be investigating more outcomes. This second one there, Best Start Evaluated Research funded by MSD, that's just starting this week. And then work that Lisa and myself are doing, assessing the impact of sex work decriminalisation in New Zealand, a feasibility study. Again, this was a friend of a colleague of a friend really got in touch with us from the University of Cincinnati, who was aware of the New Zealand situation of the decriminalisation of sex work through the Prostitution Reform Act in 2003, and also was aware that we worked with administrative data and wanted to see if we could identify sex workers in administrative data, one, and if we could, look to see if we can see if there's been health impacts and other social impacts on sex workers. And one of the reasons they want to do that is they are attempting to change the law in Ohio, and they think what will help them change the law in Ohio, where they are, is some hard evidence from administrative data, collected data, which is why we're doing this work. And that's speak on behalf of Alicia, but I think it's been a really fun project to work on. And working closely with Sex Work Aotearoa as well as a community group there. The one below that, a relatively small project, but again, actually this was an interesting one as well, how it came about. We're at the Christmas function of the Te Paeroa group I mentioned before, and they did a fantastic job at this Christmas function. They invited all these people along who didn't know each other. They stood up and announced who everyone was in the room and how they worked with them. And they said, now you know who each other is, go and talk to each other. You may have interests together. And then Natalie from the Urban Advisory came up and said, you do survey work. Can you help us with this survey that we're running? And so that's how that sort of kicked off. And so they've run a survey on people's housing needs, essentially, across the country. And they wanted our help to analyse it. And also, Martin over there is going to be helping a bit with developing a new survey or new questions they might want to ask the people. And the final one I highlight, and we're doing a few other things other than these, whatever it is, 8 that I've highlighted, Tangata Whai Kaha Māori Probabilistic Panel Survey Research. That's funded by TANIFA, who you may or may not have heard of, but they were set up by the previous government to coordinate research around infectious disease. This was brought in around the time of COVID. And we put in a bid there to use an existing sampler that we had to run which we developed a Māori survey on disability to understand the experience of Māori, their experience of disability. And we thought we could use that same sample to answer questions about people's views about infectious disease approaches. So, vaccine mandates and those sorts of things. And so we're trying to set up a probabilistic panel so that we can ask the questions of that TANIFA want on infectious disease on this panel, but going forward as well, perhaps ask other questions that are of importance to Māori. But I should point out we've had one failure in the past in trying to set up a probabilistic panel. So, sorry, panel by panel, I mean, you've probably heard of these things where often people join these things, flybys as one, and then they contact you and you do surveys for them. We have argued for a while there that it's good to have one that's probabilistically drawn, so you can draw conclusions about the population a bit better. And there's a few of these overseas, none yet in New Zealand. And then you can go back to this panel from time to time and ask questions of them. Anyway, so that's just a little bit of a flavour of the type of research that we do. And as you can see, I think I've given you a flavour as well. We work a little bit with communities as well. And I think we probably work, well, we definitely are working more with communities than we were, say, 5 years ago. I think it's something we've moved towards. Now, I mentioned that we do surveys. So 2 lots of surveys that we are heavily involved with. The first one is the International Social Survey Program. So that's a group of around 45 countries in the world. And what they do is they run a social science survey. There are topics there each year. And the survey is run across all those countries in that year, but the topic changes year on year, around a 10-year cycle. So this year, soon we'll start development of a survey on work orientations. And various other surveys have been run over time: role of government, social networks, religion, social inequalities, environment, health and healthcare, gender roles, national identity and citizenship, and visual societies. Next Thursday, I'm going to Pula in Croatia to meet with this group. And what we do there is we decide on the final content for next year's survey, which will be role of government on the 10-year cycle. And it's a funny setup. Set up to be democratic, not necessarily to design to be a survey, but it's set up to be democratic. So you go along there, there's this big table, and your country's name is there. And so I'm, next to the Netherlands on one side and Norway on the other side. And you sit down and you vote, question by question, on which ones go on the survey. So it's set up very much like the UN, which is kind of interesting. But yeah, it's really, really fun to do these surveys, and lots of interesting stuff is produced from those things. We run that. We run also the New Zealand election survey after every election. We've done 5 of those now. And I think we'll be involved in the next one and coming up soon, really, another 18 months, 2026. So that is more or less on the day of the election, a survey goes out to us, a random sample of people who are on the electoral roll, asking about their political views and their voting patterns and those sorts of things. And others that I've mentioned already, the survey of Māori creatives,
Okay, I've mentioned all three of those actually. The Te Ao Marama was the disability survey that I say we're building on to do the development panel. And then the Papakainga survey, the housing survey with Ngāti Hauara. Okay, another thing that we do is we run some methodological short courses. We run them twice a year, once in Wellington in November, December, and once in Auckland in February. These are the types of courses that we run. And if you're interested in these, we haven't got flyers. Sometimes when we have these events, we bring on flyers. We're going to have those at the moment. But if you're interested in these events, you can go to compass.auckland.ac.nz short courses, and you'll get a list of these. And next month, so these things will be live, where you can start booking these things. Some of them are online, and some of them are in person. Up until COVID, they were mostly all in person, but everything changed with COVID, and we shifted the number of them online. There's a couple that we contribute to directly. Mostly we bring in teachers from Australia. We're part of a group called AXFREE, who teach a lot of courses. But we also teach the Introduction to the Integrated Data Infrastructure one and the Practical Skills one as well, we help develop. Okay, that is pretty much what we are and what we do.